Recently, ACEP projected a surplus of 9,000 emergency medicine trained physicians in the U.S. by 2030, and a lot of people are upset and angry about it. What's the problem? Why is this happening? Once upon a time, EM physicians were notorious for resisting corporate compliance, being expensive to pay, and being tough to replace if they burned out and quit. Medical corporations realized the cheapest solution was to create privately funded EM residencies with no limit on the number of graduates. This creates a surplus of doctors who pay for themselves through resident labor, much cheaper than preventing burnout with costly steps like reducing ED boarding times or fixing staffing shortages or cutting administrative grifting. Instead of spending all that money, they've created plentiful, obedient replacements who are desperate for work. This way, they don't have to care about physicians burning out because there's lots of replacements. It's much, much cheaper. Corporations are also saving money by replacing physicians with cheaper, rapidly certified non-physicians, like nurse practitioners or physician assistants. Now, they still need a few physicians on staff to supervise these non-physicians for extra insurance company payouts, but privately everyone knows there's too few doctors to really supervise. Still, if a non-physician has a bad patient outcome, the supervising physician is the liability magnet, and thanks to the surplus of EM doctors, they can be replaced like toilet paper. The physicians can put up with it or they can leave, but they have no leverage. How did we get here? Aren't there laws saying that hospital staffing companies have to be run by someone with medical training so patients are protected? Yeah, but it's easy to get around these laws by hiring a well-paid figurehead doctor who provides a face for the medically trained part of the requirement, but has no say in how things are done. These figurehead docs can't veto decisions made by the corporation, and if they complain, they are quickly and easily replaced. It's a loophole that nobody wants to close because of all the money involved. All these cost-cutting tricks yield incredible profits with few downsides for shareholders. There's a limitless supply of customers who will always pay because there's no competing system for emergencies. Shareholders don't get sued, providers do. Corporate medical groups know that human suffering is an inexhaustible natural resource, and they've deflected the consequences for exploiting this resource on the undersupport and oversupply of physicians, which they created themselves. It's really quite brilliant. What are doctors doing about this? A lot of them are doing nothing because they have cush administrative jobs that feed off this system. Even professional organizations for emergency medicine are making a lot of money by training and certifying non-physician replacements for emergency physicians. Should a professional organization be making money by putting its own members out of business? A lot of people don't think so. Some physicians are trying to get the government to investigate these practices for possible fraud, but there's a huge amount of money involved, and that buys votes and influence. Most ED docs are beginning to accept that we've lost the resiliency game to a more nimble opponent, and our best option now is to fit in or walk away or create a new role for ourselves with the one thing that still belongs to us, our skills. Remember those? We lost yesterday's game, and we should stop expecting a rematch. But that doesn't mean we can't create a new future.